Good day, everybody. My name is Dr. Fred Foley, and I am a professor of psychology at Yeshiva University in the beautiful Bronx, New York, and the director of neuropsychology and psychosocial research at the Multiple Sclerosis Center at Holy Name Medical Center in Teaneck, New Jersey. Over the last 30-something years in working with people with MS, many have come up to me and told me, hey, what about my sex life? And their kind of initiation of asking me these questions led me to start doing research on this topic. And so before I talk about how often sexual dysfunction occurs in MS and what you can do about it, it's important to put it in context. It's important to know, well, how often does this happen in the general population? And so studies on the general adult US population between the ages of 18 and 65 indicate that about 43% or more of adult persons in the US report at least occasional sexual dysfunction. So I just want to make the point that this is not something that just happens in people with central nervous system disease. This is widespread, at least occasionally in the general population as well. Now, when you add MS into the mix, our epidemiology studies have found that in persons with MS, about 68% of persons with MS have reported severe and persistent sexual dysfunction of different types. So it's common in the general population, but it occurs much more in MS. And this is not surprising. MS, can cause lesions anywhere in the spinal cord or the brain, particularly heavily myelinated areas. And our sexual response is mediated by the cord in the brain. So it's not surprising that this is a very common symptom in MS. What is surprising is that so few healthcare providers ask patients about their sexuality and their sexual health. And so I encourage all of you to ask your providers, your healthcare providers, for help if this is an issue for you, as it may be in maybe 68% of you. So, and what we found in our studies of physicians and MS nurses, that if the patient introduces the topic and asks, even if the person doesn't feel they have expertise in the area, they will feel obligated to try to help you with this and find you educational materials or a provider that can help you with this. So, lesson number one, speak about it and ask your healthcare providers, because there is help out there. So the kinds of things that men with MS complain about in terms of their sexuality is erectile dysfunction is the number one complaint that men have. Now, this is also not surprising, since erectile dysfunction is the number one complaint men have in any study of sexuality in any population. So the same is true for MS. They also reported that a lot of them experience difficulties with sensation, loss of sensation in the genitals, or reduced sensation in the genitals. And this is a problem that women report with great frequency also in MS. They also experience different kinds of emotional related sexual issues. For men, it was performance anxiety, worried about pleasing their partner. And for women with MS, it was body image related concerns, body image issues that prevented them from being able to have a fulfilling sexual experience. So, although men and women report different types of problems, we found that the frequency with which men report problems in MS and women report problems with MS is virtually identical. So they may have different problems, but they occur with similar frequencies. So we categorize, since the sexual problems in MS are so complex, into different types. We call them primary, secondary, and tertiary problems. Primary problems are problems that are caused by a lesion that directly impairs sexual function or satisfaction. For example, if a male or a female has a lesion in the sacral area of the spine, it's almost certain to cause sexual problems in both men and women. So that would be an example, like genital numbness, which is frequently caused by sacral lesions, would be an example of a primary problem. Secondary problems are problems that are caused by MS indirectly. For example, severe fatigue. 90% of persons with MS experience significant fatigue at times. And this is a kind of fatigue. It's not just like being tired at the end of the day. It's an illness-related fatigue. And, when you're feeling that fatigue, you really aren't that interested in intimacy. So it does interfere. Likewise, bladder problems also frequently occur in people with MS, and that's another secondary problem. The nerves that mediate sexual response are proximal to those that mediate bladder function. And many people have reported to me over the years that they're embarrassed about having bladder leakage during a sexual encounter. So that's another example of a secondary problem. A tertiary problem example would be the body image concerns, psychosocial or cultural issues that interfere with optimal sexual and intimate functioning. So these are the common problems that we find in MS. And in terms of treatment, there's one thing I want you to remember. In all of our studies, we found that if we can get the partners talking about it with each other in a non-judgmental way and just brainstorm with each other and talk to their healthcare providers about it and get educational materials like from different organizations like the National MS Society on sexuality, sexual function, and what you can do about those issues. We have found significant improvements, even in primary sexual problems such as decreased sensation in the genitals. We did 2 studies, one randomized clinical trial on women with MS, and we chose women because most of the MS population is female, and secondly, the fewest numbers of sexuality have been done on women. So we wanted to see what we could learn and how we could help women with MS. And we found that just providing educational materials in this randomized clinical trial and referrals, like you might go to your provider, your neurologist or physician and say, hey, I'm having a problem. I have genital numbness or, I have body image concerns, and they might give you a referral to a local provider to help you with that. So education alone significantly improved sexual dysfunction in women with MS. And education plus a local referral from a healthcare provider also improved sexual functioning significantly. So there's many technical aspects of it that we might educate you about and might help you about, like, how to deal with fatigue, or how to kind of manage spasticity, or how to manage other symptoms that interfere. But all that education kind of about managing these symptoms so that you can have a more fully engaging and pleasurable, intimate and sexual life is available, those educational materials. So, major lesson, kind of empower yourself, ask about it to your healthcare provider, ask for help with this issue, and begin talking to your partner about it. Start with getting educational materials about sexual health and MS. Read it with your partner. Discuss it with your partner. And we have found that these approaches alone will help significantly, in addition to the technical aspects of having kind of an expert help you. These alone, you can do on your own. And in our studies, we found them helpful. I want to say thank you very much for inviting me here today and having this opportunity to talk about how you can improve, sexual and intimate experiences when you have multiple sclerosis.